I think something that really drew me to working at Trillium when I was a therapist was because Trillium offers so many different levels of treatment and different treatment settings that I knew that even if I started in one arena like the school-based outpatient program, I had so many opportunities to work across the different treatment levels, work with different families, work in unique settings. And I knew that as my career progressed, I've had a lot of different opportunities in different places to grow and advance my own career. Also at an organization like Trillium, we work so closely with so many other different layers of the system. So you have opportunities to work with school professionals, with teachers, with principals, with DHS caseworkers, with CASAs, with lawyers, people who work at the health plans. You really get to see inside the full mental health system. And in building those relationships that you do when you're maybe just working with one individual family and all of those different supports that support them, you get to work with all those other professionals. So one, you get their perspective on what you're dealing with and what you're navigating as a group. And two, you get to really see what their work is like and what their job environments are like. And as you build those relationships over the years, your career may progress to working with a lot of those different organizations. I sit in many high-level mental health meetings across the sector for children in Oregon, and so many of those different professionals have worked for Trillium at different times in their careers. And it's just a great experience to build that system together and to have everybody's unique perspectives. Sometimes when you're working in a more isolated environment, at least for a therapist, you have to go to clinical supervision, and really just from your lens, you're explaining a difficult situation you might be working with. But when you're working in an integrated setting like ours, you have so many other different players that know exactly what you're facing and what you're experiencing, and you don't have to just tell that story from your perspective to get advice or counsel on how to handle it. They have their own lens and their own psychiatry or psychology, nursing, other treatment professionals, peer specialists who are knowing exactly what you're working with and can give you their experience and their perspective on the situation in a much richer way than you can get when you're going to kind of a one-off supervision and having to tell the story just from your singular perspective. And I've really appreciated having that diverse perspective from so many different professionals, and working in such a close setting. It really feels like you're not isolated and that you're not working in a vacuum.